Question 1. A patient presents with diabetic chronic kidney disease, stage 3. A. N 18.3, E 11.22. B. E 11.22, N 18.3. C. E 11.9, N 18.3. D. N 18.3. Answer: B. E 11.22, N 18.3. This question tests the coding of diabetes with a complication. The ICD-10 CM tabular list instructs that code category E11, type 2 diabetes mellitus, has an instructional note to use additional code to identify complication. Code E11.22 is a combination code that captures both the type of diabetes and the chronic kidney disease manifestation, and the kidney disease stage N 18.3 is then coded separately to provide more detail. Therefore, the diabetes code, E11.22, is sequenced first as the underlying condition, followed by the code for the specific stage of chronic kidney disease. Remember to always follow the instructional notes and sequencing rules when coding conditions linked by, with, or due to in the code descriptions. Question 2. A patient is admitted for chemotherapy for primary malignant neoplasm of the breast. A. Z 51.11, C 50.919. B. C 50.919, Z 51.11. C. C 50.919. D. Z 51.11. Answer: A. Z 51.11, C 50.919. This scenario involves coding for chemotherapy administration. When a patient encounter is solely for the administration of chemotherapy, the code for the chemotherapy Z 51.11 is sequenced as the principal diagnosis. The underlying malignancy that the chemotherapy is treating, in this case C 50.919 for the primary malignant neoplasm of the breast, is coded as a secondary diagnosis. Always sequence the reason for the encounter first according to the ICD-10 CM official guidelines for coding and reporting. Coding the cancer first would be incorrect sequencing for this specific encounter. Question 3. A patient is seen for an adverse effect of penicillin, experiencing a drug-induced rash. A. L27.0, T36.0x5A. B. T36.0x5A, L27.0. C. T36.0x5A. D. L27.0. Answer: B. T36.0x5A, L27.0. This question focuses on coding adverse effects of drugs. According to the ICD-10 CM guidelines, when coding an adverse effect, a reaction to a drug correctly prescribed and administered, the code for the adverse effect, T code, is sequenced first, followed by a code for the specific manifestation of the adverse effect. Here, T36.0x5A identifies the adverse effect of penicillin, and L27.0 identifies the drug-induced rash. Do not confuse adverse effects with poisonings, which have different sequencing rules. Always identify if the drug was correctly or incorrectly administered. Question 4. Patient diagnosed with acute on chronic systolic heart failure. A. I 50.21. B. I 50.22. C. I 50.23. D. I 50.9. Answer: C. I 50.23. This question tests your understanding of combination codes and acute on chronic conditions for heart failure. ICD-10 CM provides specific combination codes for different types and severities of heart failure. Code I 50.23 specifically represents acute on chronic systolic, congestive, heart failure. Selecting this single code accurately captures both the acute and chronic nature of the systolic failure. Avoid using separate codes for acute and chronic when a combination code exists, and choose the most specific code available. Question 5. A patient with known essential hypertension and chronic kidney disease, stage 4, is seen for routine management of both conditions. A. I-10, N18.4. B. N18.4, I-10. C. I-13.11. D. I-13.11, N18.4. Answer: C. I-13.11. This scenario involves coding hypertension with chronic kidney disease. The ICD-10 CM guidelines state that combination codes are used when a causal relationship between hypertension and chronic kidney disease is stated, implied, or documented as being related, which is standard practice for hypertensive chronic kidney disease. Code I-13.11 is a combination code representing hypertensive heart and chronic kidney disease with stage 4 chronic kidney disease. Remember that when a combination code exists for hypertensive CKD, you do not code the hypertension, I-10, or the CKD stage, N18.4, separately. The combination code includes both. Question 6. Patient admitted for dehydration due to severe gastroenteritis. A. K52.9, E86.0. B. E86.0, K52.9. C. K52.9. D. E86.0. Answer: B. E86.0, K52.9. This question asks about sequencing when one condition is due to another. According to ICD-10 CM guidelines, when a condition is documented as being due to another condition, as in dehydration due to gastroenteritis, the code for the underlying condition causing the manifestation is typically sequenced first, followed by the code for the manifestation. In this case, gastroenteritis, K52.9, is the underlying cause of the dehydration, E86.0. Sequencing dehydration first would be incorrect, as it is the result, not the cause, of the gastroenteritis. Question 7. Patient presents with gangrene of the right foot due to type 2 diabetes mellitus. A. E11.51, R02. B. E11.51. C. R02, E11.51. D. E11.9, R02. Answer: A. E11.51, R02. This scenario involves a diabetic complication that requires two codes, one for the specific complication and one for the manifestation. Code E11.51 is a combination code representing type 2 diabetes mellitus with diabetic gangrene. However, the ICD-10 CM tabular list instructions for E11.51 state use additional code to identify gangrene, R02. Therefore, you must code E11.51 first to indicate the diabetes with gangrene, and then use R02 to specify the manifestation of gangrene. Simply coding R02 alone would not indicate it is diabetic gangrene. Question 8. Patient diagnosed with osteomyelitis resulting from an infected prosthetic joint implant in the left hip. A. T84.531A, M86.9, Z96.642. B. M86.9, T84.531A, Z96.642. C. T84.531A, M86.9. D. M86.9. Answer: A. T84.531A, M86.9, Z96.642. This question tests coding complications of prosthetic devices and the resulting condition. The primary reason for the encounter and the most significant condition is the complication of the prosthetic hip causing osteomyelitis. According to guidelines for complications of medical and surgical care, the code for the complication, T-code, is sequenced first, followed by the code for the specific condition resulting from the complication. T84.531A codes for infection and inflammatory reaction due to internal prosthetic hip joint, initial encounter, M86.9 codes for the resulting unspecified osteomyelitis, and Z96.642 indicates the presence of the left hip joint prosthesis. Ensure you capture the complication, the manifestation, and the presence of the device, sequencing the complication code first. Question 9. A patient is admitted due to intractable major depressive disorder, single episode. A. F32.0, F32.A. B. F32.9, F32.A. C. F32.2. D. F32.2, F32.A. Answer: C. F32.2. This question asks about coding the severity and nature of a mental health condition. ICD-10 provides specific codes that combine the type of depressive disorder, major depressive disorder, single episode, with its severity, intractable. Code F32.2 specifically represents major depressive disorder, single episode, severe without psychotic features. The term intractable indicates a severe or persistent form of the condition, which in this case is captured by the severe designation. There is no separate code for intractable, so you use the code reflecting the highest severity documented, which is severe. Question 10. Patient presents with acute cystitis due to E. coli. A. N30.00, B. 96.20. B. N30.00. C. B. 96.20, N30.00. D. N30.00, B. 96.2. Answer: A. N30.00, B. 96.20. This scenario requires coding both the infection and the bacterial agent causing it. According to ICD-10 guidelines, when a bacterial infection is documented, you code the specific infection first, followed by a code from category B95 B97 to identify the bacterial agent. N30.00 codes for acute cystitis, and B96.20 is used for Escherichia coli, E. coli, as the cause of diseases classified elsewhere. You must use both codes to fully describe the condition and its cause. Question 11. Patient presents with dizziness secondary to labyrinthitis. A. H83.0x1. B. H83.0x1, R42. C. R42, H83.0x1. D. R42. Answer: A. H83.0x1. This question tests your understanding of when to code symptoms versus definitive diagnoses. Labyrinthitis, inflammation of the inner ear, is a definitive diagnosis, H83.0x1, and dizziness, R42, is a symptom of it. According to ICD-10 guidelines, when a definitive diagnosis is established, you should code only the diagnosis and not the symptom unless the symptom is not inherent to the diagnosis or represents an additional condition. Since dizziness is a common and expected symptom of labyrinthitis, you only code the labyrinthitis. Question 12. Patient seen for follow-up after surgical removal of malignant melanoma of the right arm, with no residual tumor. A. C43.61. B. Z08, C43.61. C. Z85.821. D. C43.61, Z85.821. Answer: C. Z85.821. This scenario involves coding the history of a malignant neoplasm. When a patient is seen for follow-up care after the malignant neoplasm has been completely removed and there is no recurrence or residual tissue, you code the history of malignancy. Code Z85.821 represents personal history of malignant melanoma. You do not code the active malignancy, C43.61, once it has been excised and is no longer present. Question 13. Patient presents with severe protein-calorie malnutrition due to chronic pancreatitis. A. K86.1, E43. B. E43, K86.1. C. K86.1. D. E43. Answer: B. E43, K86.1. This question asks about sequencing a nutritional deficiency resulting from another condition. According to ICD-10 CM guidelines, when malnutrition is due to a specific underlying condition, the malnutrition code is sequenced first, followed by the code for the underlying condition. Here, E43 codes for unspecified severe protein-calorie malnutrition, and K86.1 codes for chronic pancreatitis. While the pancreatitis is the cause, the malnutrition is typically considered the principal or most significant condition treated in this type of scenario, driving the encounter. Question 14. Patient admitted for treatment of pathological fracture of the right femur due to senile osteoporosis. A. S72.901A, M80.051A. B. M80.051A, S72.901A. C. S72.901A. D. M80.051A. Answer: B. M80.051A, S72.901A. This scenario involves a pathological fracture due to an underlying bone condition. According to ICD-10 CM guidelines, when coding pathological fractures, the underlying disease, like osteoporosis, which weakened the bone, is sequenced first, followed by the code for the pathological fracture itself. Code M80.051A is for age-related osteoporosis with current pathological fracture, right femur, initial encounter for fracture. Code S72.901A is for unspecified fracture of right femur, initial encounter for closed fracture, which specifies the fracture site but is sequenced second. Note that M80 codes are combination codes for osteoporosis with fracture and are sequenced first. Question 15. A pregnant patient in her second trimester, 15 weeks, with acute appendicitis. A. O99.612, K35.80. B. K35.80, O99.612. C. K35.80. D. O99.612. Answer: A. O99.612, K35.80. This question involves coding a condition complicating pregnancy. According to the Obstetrics Chapter, Chapter 15, Guidelines in ICD-10 CM, if a condition arises during pregnancy that is not related to the pregnancy itself but complicates it, you code a code from O99 for other maternal diseases complicating pregnancy, childbirth, and the puerperium first, followed by the code for the condition itself. O99.612 codes for diseases of the digestive system complicating pregnancy, second trimester, and K35.80 codes for acute appendicitis, unspecified. Always sequence the O code first when a condition complicates the pregnancy. Question 16. Patient presents with fever and cough. Physician documents suspected pneumonia. A. R50.9, R05. B. R50.9. C. R05. D. J18.9. Answer: A. R50.9, R05. This question tests the coding of symptoms versus a suspected diagnosis. When the physician documents a suspected diagnosis, and that diagnosis is not confirmed, you code the signs and symptoms that led the physician to suspect that diagnosis. In this case, the patient has fever, R50.9, and cough, R05, and the physician suspects pneumonia, J18.9. Since pneumonia is not confirmed, you only code the documented symptoms. Only code a diagnosis when it is documented as confirmed. Question 17. Patient has a history of myocardial infarction, MI, that occurred 2 months ago and is now experiencing unstable angina. A. I-21.9, I-20.0. B. I-25.2, I-20.0. C. I-20.0, I-21.9. D. I-20.0. Answer: B. I-25.2, I-20.0. This scenario involves a patient with sequela of a previous MI presenting with a new, related condition, unstable angina. According to ICD-10 CM guidelines, code I-25.2 is used for old myocardial infarction, indicating a healed MI that occurred more than 4 weeks prior. Code I-20.0 is for unstable angina. When a patient has a history of MI and presents with unstable angina, you code both, using the history code I-25.2 to indicate the healed MI and the code for the current unstable angina I-20.0. Do not use an acute MI code, I-21, unless the MI is current, within the last 4 weeks. Question 18. Patient admitted for treatment of uncontrolled type 1 diabetes mellitus with hyperglycemia. A. E10.65. B. E10.9, R73.9. C. E10.649. D. E10.649, R73.9. Answer: C. E10.649. This question tests coding diabetes with hyperglycemia. Code E10.649 is a combination code that represents type 1 diabetes mellitus with hyperglycemia. The term uncontrolled typically points to a state of hyperglycemia or poor glucose control, which is captured by this combination code. There is no separate code for uncontrolled, and you do not need an additional code for hyperglycemia, R73.9, when using this specific combination code. Always look for combination codes that fully describe the condition. Question 19. Patient seen for chronic lower back pain due to degenerative disc disease in the lumbar region. A. M51.36, G89.29. B. G89.29, M51.36. C. M51.36. D. G89.29. Answer: A. M51.36, G89.29. This question involves coding chronic pain resulting from an underlying condition. According to ICD-10 CM guidelines, when chronic pain is documented as being due to a specific condition, you code the underlying condition first, followed by a code from category G89 for chronic pain. M51.36 codes for other degenerative disc disease, lumbar region, and G89.29 codes for other chronic pain. Coding the degenerative disc disease first indicates the cause of the chronic pain. Note that G89 codes are generally sequenced second when linked to a specific cause. Question 20. Patient presents with bilateral severe osteoarthritis of the knee. A. M17.11, M17.12. B. M17.11, M17.12, M17.0. C. M17.0. D. M17.0, M17.11, M17.12. Answer: C. M17.0. This question tests the use of combination codes for bilateral conditions. Code M17.0 is a combination code specifically for bilateral primary osteoarthritis of knee. When a condition is bilateral, affecting both sides, always check if there is a single code that captures the bilateral nature. Using separate codes for the right, M17.11, and left, M17.12, knees is unnecessary and incorrect when a bilateral code exists. Severity, like severe, may sometimes be captured at a later character level, but M17.0 is the appropriate code for bilateral involvement. Question 21. A patient with a history of colon cancer presents for a screening colonoscopy. The colonoscopy is negative. A. Z12.11. B. Z85.038. C. Z12.11, Z85.038. D. Z00.00. Answer: A. Z12.11. This scenario involves coding for a screening procedure when the patient has a history of the condition being screened for. When a screening exam is performed due to a personal history of the malignant neoplasm, the screening code is sequenced first. Code Z12.11 is for encounter for screening for malignant neoplasm of colon. While the history of colon cancer, Z85.038, is relevant information, it is coded second, if at all, and the primary reason for the encounter, the screening, is coded first. A negative finding during screening does not change the reason for the encounter. Question 22. Patient admitted for acute exacerbation of chronic obstructive pulmonary disease, COPD. A. J44.0. B. J44.1. C. J44.9. D. J44.0, J44.1. Answer: B. J44.1. This question tests coding for acute exacerbations of chronic conditions like COPD. Code J44.1 is a specific combination code for chronic obstructive pulmonary disease with acute exacerbation. This single code captures both the underlying chronic COPD and the current acute exacerbation. You do not need separate codes for chronic COPD, J44.9, and the exacerbation when this combination code is available. Always choose the most specific code that reflects the patient's condition. Question 23. Patient presents with sepsis due to methicillin-resistant Staphylococcus aureus, MRSA. The infection site is unknown. A. A41.9, B95.62. B. A41.02. C. A41.02, B95.62. D. R65.20, B95.62. Answer: B. A41.02. This scenario involves coding sepsis with a specific bacterial organism. According to ICD-10 CM guidelines, when sepsis is documented as being due to a specific organism, you code the specific type of sepsis first. Code A41.02 is specifically for sepsis due to methicillin-resistant Staphylococcus aureus, MRSA. You do not need an additional code from B95-B97 when the sepsis code itself includes the organism. This is a combination code where the organism is integral to the diagnosis description. Question 24. Patient diagnosed with chronic pain syndrome. A. G89.29. B. G89.4. C. R52.2. D. G89.20. Answer: B. G89.4. This question asks for the correct code for chronic pain syndrome. According to ICD-10 CM, code G89.4 is specifically assigned to chronic pain syndrome. This is a designated code for a syndrome, distinct from other chronic pain codes, like G89.2X, which are typically used when the pain is associated with a specific site or condition. When the documentation uses the term chronic pain syndrome, G89.4 is the correct code to capture this specific diagnosis. Question 25. Patient admitted following a fall downstairs at home, resulting in a closed fracture of the left ankle. A. S82.842A. B. S82.842A, W10.8XXA, Y92.009. C. S82.842A, W10.8XXA. D. S82.842A, Y92.009. Answer B. S82.842A, W10.8XXA, Y92.009. This scenario requires coding an injury and the associated external cause and place of occurrence. According to ICD-10 CM guidelines for injuries, the injury code, S82.842A for closed fracture of the left ankle, initial encounter, is sequenced first. This is followed by external cause codes detailing how the injury occurred and where. W10.8XXA codes for fall down stairs, initial encounter, and Y92.009 codes for unspecified place in single-family house as the place of occurrence. You must capture the injury, the event that caused it, and the location of the event to fully describe the circumstances.